Hello everyone, let's start today's practice. This is mostly for people who has back issues and back pain, shoulder pain or any joint pain. People with little more flexibility issues or bone strength is very less. So let's start practicing. Nowadays with 30 plus age as well, without lack of movement, we get lots of body pain in day to day life. So do this at least thrice a week. If you can do it regularly. We'll start with shoulders, then we'll go to hip so that it will be easier for remembering. Let's start without further delay. We'll start with shoulders. So with wall support, keep your wrist exactly below your shoulder joints. This is like a standing push-up position. So what we'll do now, pull your shoulders out as much as possible. You should be able to feel your scapular joints nicely and press your chest down. Your shoulder blades should come together and your chest should come close towards the wall. You can feel the body weight here, but little bit lesser. If you feel it is very easy for you, we'll do the next version. But anyway, you do this as a warm up if you are little more in higher state. So let's start. If it is good, okay for you, or you practice this for 2 or 3 days, then we'll go for the next one. Do this normal push-up position, but bring your knee close, just like a table, and keep your knees little bit 2 fingers above, and do the same with your shoulders, up and down. At least hold 2 to 3 seconds each position, 5 to 10 times more than enough. You can repeat it 2 or 3 sets. If it is also easy for you, you can go to plank position and try moving the shoulders as I have shown, similar way. So any way you have to do this for your shoulder mobility. Okay, second one, again for the shoulder, come close to the wall. Your chest should touch nicely and stretch your hands on the wall. Walk on your fingers towards the ceiling and now feel the stretch at your shoulder joints. It's very easy but much effective. Now do this as much as you can, 5 to 6 times. This is the final one. There is no alternative version, easy one. So continue at least same 3 sets, 2 to 3 times each. Hold for 5 to 10 seconds. That's more than enough. The last one of this will come to hip joints. So hip joints, if we take care, it will take care sciatica and lower back pain. Sometimes we get acute pain at the exactly tailbone points. So those kind of issues will be resolved. Easy one, try to do it nicely. So with wall support, always catch the wall, lift the leg, like imagine your hip joints and the way it is moving in day-to-day life, functional way, all direction we need to take care. So first start with side weight and hold for 5 seconds, slow drop. Hold for 5 seconds, slow drop. So don't force yourself, as much as you can will be doing this. Once it is done, do it the other way. Suppose first we did side, now we are doing up and down, front and back. Same, we'll do slow. Don't swing, just feel the leg weight at our hip joint. So hip bone will get strengthened with the weight of your leg. Once it is done, we can slowly add weight on our leg and continue the same. So you can feel any weight you can tie at your ankle and do the same once you are little more pro, so that your hip joint will be more stronger. So this will take care of your lower back especially. Then with wall support itself, bring your knee to the chest, slow down, hold, slow down. 2 to 3 seconds hold always, 2 to 3 sets, 5 time repetition you can do. Now once you feel comfortable, if your knee is not paining at all, little bit will give pressure to our knee with wall support of course. Just try this for 5 to 10 times, 3 sets. Very easy and simple one. This is for hip joints and knee. Last but not the least, we'll do little bit for our complete lower back pain. So one instruction, or you can say precaution, if it is very painful and if you feel there is a swelling on your lumbar region or L1, L2, L3 anywhere, then try avoiding this initially. Once you feel your lower back little bit strengthening, and do it with support. When you feel good, try. So I'll give you 2 to 3 variation of this. Try this first with brick support. So you can try as I am showing it here. Adjust your brick and just keep your upper body there, and brick should touch close towards your navel point. If it is difficult, you can adjust as for your convenience. Now do this in this position. This is Bhujangasana, you can see Sarala Bhujangasana. Once you are comfortable, you can do Sarala Bhujangasana with elbow support without using the bricks. Once Sarala Bhujangasana also good for you, then you can do keeping elbow straight, looking up to the ceiling. Each one you can repeat 5 to 6 times, holding 5 to 6 seconds. If you are good enough, you can go little more higher. But again, I am remembering this is only if you don't have any acute pain at your lower back. Second, we will be going to Salavasana with brick support. So keep your bricks under your thighs, complete forehead touching to the floor. Now with brick support, lift your legs up. You can do one leg at a time. If you are doing good, then try with both the legs. The more height of the brick, it will be more difficult. Once these two done, then we'll be doing with wall support again. So try with the lesser height. Like as you can see, I'm keeping my hands position little close to the wall. Like height will be lesser. I'll be little away from the wall. Once you are doing good, come close to the wall and try to touch your chest to the wall. If it is you feel very difficult, you can try any elevation surface, just like a stool or chair or anything else. So try this. It is very beneficial for complete spine from your lower back to shoulder joints. So these three good enough. Last one, as I will suggest, lie down in Savasana. Take both the hands over your head, or you can stretch both the hands as for your space. Then get back to me, write comment below if any improvement or you need any suggestion in doubt. I'll be very happy to guide you. Stay tuned. Thank you.